of flu cases in Iowa is on the rise.
And experts are alarmed at the number of pediatric cases that have turned deadly. KCCI's Mark Tauschek is live in the newsroom with new information tonight.
Well, guys, last night we reported on the flu-related death of a 3-year-old girl in Elkhorn. Today, the deputy epidemiologist with the State Department of Public Health confirmed that her office is currently working to confirm 3 pediatric flu deaths here in Iowa, a number she calls concerning.
Aisley McCarthy died Monday morning at Blank Children's Hospital, less than 48 hours after she started showing symptoms. Doctors told her parents she died of a combination of influenza and sepsis. Her mother told KCCI Aisley did get the flu vaccine, as did her siblings.
We know it's widespread and we know it's circulating, this year it's affecting children more than ever.
A spokeswoman for the Polk County Health Department says this year's vaccine has been ineffective against one influenza strain, H3N2, a strain that can cause severe illness. But she says the vaccine is working well against the other 2 strains.
There's always opinions that people say it doesn't work or it does work, but we know it does work.
The State Department of Public Health is currently investigating 3 possible pediatric deaths from the flu. Look at how that compares to the previous years in Iowa. The past 3 years combined, there's been only 1 child flu death.
Washing our hands a lot and trying to stay away from people who are sick.
Jennifer Heimig says she was shocked to learn of the flu death of the 3-year-old.
If my kids get sick, I would expect them to get well again. They're healthy. I wouldn't expect them to go to the hospital and die 48 hours later.
Heimig says her kids were vaccinated. If you haven't, experts say even though it isn't as effective as previous years, it still offers protection. At this Unity Point clinic on Ingersoll, this nurse practitioner says most of the flu cases she's treated have been patients who were not vaccinated.
We have the intranasal.
And her clinic currently has 300 doses waiting to be claimed.
It seems like a smaller portion of our patients are getting immunized. So of course our practice has grown and we would think that our immunizations would grow with it, but it hasn't.
The State Department of Public Health says they will have more information on these 3 potential pediatric flu deaths sometime next week. The health educator for Polk County told me today the big indicator to differentiate between common cold and flu symptoms is the flu will come on very quickly. You'll see a possible fever, sore throat, runny nose, aches, and fatigue appear all at once. Live in the newsroom, Mark Tauschek, KCCI 8 News, Iowa's news leader.